Good afternoon, everyone, or good evening, good morning, wherever you are. Welcome. My name is Marilyn Shannon, and this is the Breaking Free Show. And I am so happy to be here with you today. I look forward to it each and every week. And when I'm not here, I am thinking about you in all that I do. Believe me. What can I bring to the show today? Who can I introduce you to? What can we learn together that will make a difference in each of our lives and on this planet? And today will be one of those shows. You know, we're not afraid to do anything here. So before I get started and I introduce my guests, I just want to say hi to Amnon. You
Hello,
there?
Marilyn. How are you?
Hi. Good, Amnon. How you doing?
I'm fine. How's your mom?
She's moving into her own apartment on Wednesday,
Good.
Wednesday. So she's moving along. She feels better, and thank you for asking. So it's been a long haul, but here we go.
Yep.
Next chapter in her life, and she's 95. So next chapter in her life, and next chapter in our family's lives. So it's going to be great. So thanks. So anyway, we're going to introduce my guest, but before I do, I just want to remind you all that you are welcome to join us in our chat. Just put your name, nickname, whatever you like under our video, and you can ask questions, you can comment, whatever you like in there. We'd love to hear from you. This is a live show. So it's your opportunity to, connect. It's like, this is our home here, and we want you to do it. So anytime you have a thought, an idea, an experience, a circumstance, please feel free to bring it to us. You can also call us at 919-518-9773, and you can contact us through Skype, and that would be computers, and then the number 2K voice. Anytime you want, we're here to hear what you have to say. So with that, I'm going to introduce my guest to you today. Carole Joffe, welcome.
Thank you. Very nice to be here.
Well, it's very nice to have you here. And David Cohen, thank you so much for being here.
Thank you for having us.
It's a pleasure. So we've tried to do this once before and we had to postpone it. And I believe things happen for a reason. So today is going to even be better than the last time we were going to be together. So why don't we start with you, Carole? Tell us some things about you, and then I'm going to let you introduce David.
Okay. Well, thank you again, Marilyn, for having us. I'm a sociologist. I live in the San Francisco Bay Area. As your listeners know, we've had a lot of fires here, but sort of calmed down today. I have studied the abortion issue and reproductive health generally for many, many years. Although I'm a sociologist, I'm actually a professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the University of California, San Francisco. I work in what we might call an abortion think tank. It's a group called ANSWER, Advancing New Standards in Reproductive Health. And my colleagues and I study various aspects of abortion, contraception, and so on. So that's me. Now I'm delighted to introduce my co-author and friend, David Cohen. David is a lawyer. He's a professor at Drexel University, which is in Philadelphia. He has both litigated a number of cases in the reproductive rights field. And let me tell your listeners, as someone who studies this issue, without the lawyers, without the extraordinary group of reproductive rights lawyers we have in this country, and David is certainly one of them, the very bad situation we're facing would be even worse. Before David and I collaborated on the book we're going to talk about today, he wrote a book himself called Living in the Crosshairs, and it was a study of anti-abortion violence against providers. And you've had no shortage of that in your state of North Carolina.
David, thank you. Carole, thanks for being here. David, thanks for being here. This is like a wide open area. So it's almost like I just want to turn the clock on and say, go. But before I do that, you mentioned North Carolina. So fill me in a little bit about North Carolina.
Well, what I was referring to was the fact that in certain parts of North Carolina, particularly Charlotte, there's been unusually virulent anti-abortion action. I mean, that's what I was referring to. But until fairly recently, when you had a Democratic governor elected, there was very, very harsh laws against North Carolina. And I don't mean to diss on your very beautiful state, which has many liberated aspects, but one more factoid I'll say about North Carolina, and then I'll turn it over to David, is one of the things we discuss in our book is that in a number of states, abortion providers are mandated by the state to give really false information to their patients. For example, you have to tell your patient that abortion is correlated with breast cancer, which is not true. That abortion causes infertility, quote, which is not true. Anyway, somebody did a study of all the states that had these essentially lies that providers had to tell patients, and North Carolina had the distinction of having the highest percentage of the information you give to patients being untrue. And again, I don't mean to diss the state. There are some wonderful, wonderful activists working to overthrow these various laws. But anyway, that's my North Carolina spiel. And let me turn it over to David.
Thank you for sharing that. You know, you don't know about these things until you talk to people like you. You're right. Because I have to say, I did have an abortion many, many years ago. And I didn't know anything. I mean, as a woman, I didn't know anything. I didn't know what my rights were. I didn't know what my rights weren't. I just found out I had gotten pregnant, and it wasn't a wanted pregnancy, and it was with an IUD.
Wow.
And,
yeah. Well,
yeah.
Well, Marilyn, before I turn it over to David.
Yeah, David, we're coming.
And I apologize. I apologize for talking.
Hold on, David. Don't go anywhere. Yeah.
But I just want to say that I do commend you for speaking publicly and very straightforwardly. One of the problems with abortion stigma in this country is that understandably many women who've had abortions are very reluctant to tell anybody because they're afraid of the feedback. And I would not be surprised if you coming out publicly like this, you will get many commendations from people like me. You may get some not especially pleasant messages. So I really thank you for coming out and saying what you say.
You know, I to this day am not even sure if I was even really pregnant, because my situation was I went to have the IUD removed, and I already had 2 children. I was already divorced. I had a relationship, and I went to get my IUD removed, and I was told that I was pregnant. And I always thought that was, but I wasn't connected enough. Today I would have, I still not sure how coincidental was that I was told I was pregnant when I come in to get the IUD removed. I mean, it just seems so, when I look back on it, so weird that just that time I would be pregnant and I'm coming in to get the IUD removed. I mean, I didn't even know it.
Well, I mean, there are occasionally IUD failures. IUDs are considered extremely effective, but
right.
I mean, you might have been the 0.1%.
But it was too coincidental that I would be pregnant just when I'm coming in to get the IUD removed, and so for health, I mean, I wasn't going to keep this pregnancy anyway, and I was told that to be pregnant with an IUD wasn't healthy.
Right.
So I had to wait because it was very early on, and it was one of the most uncomfortable scenarios. Even to this day, I haven't even thought about it, but I had to go through, I don't know how long, I can't recall because it was a long time ago, how long I had to go before I could actually have an abortion.
Right. In what state?
Right here in North Carolina.
Okay.
And
so
the thought of walking around being pregnant and knowing that I was going to have an abortion, and I had to curtail my activities. I had to, think about the fact that I was pregnant, but I wasn't going to. I mean, it was a really uncomfortable.
Oh, I'm sorry. Well, I'm very sorry.
Yeah, but even so, I'm not. I wonder sometimes, even if I was pregnant, because I mean, I had the DNC and all that stuff. But it was just weird. I mean, I had an abortion, but it was just weird. So anyway, David, tell
Yes.
us. So what are you doing, David? What kind of work you doing?
I'm a law professor in Philadelphia. And like Carole said, I've been representing abortion clinics for 2 decades in legal issues in Pennsylvania and some around the country. And so I do that as some pro bono work on the side while I'm teaching. I teach mostly constitutional law and reproductive rights and sex discrimination in the law, so along the lines of what we're talking about today. And with Carole, co-author of this new book about abortion obstacles around the country.
Good.
No, and my previous book was with a different co-author, Kristen Cohen, about anti-abortion terrorism, the ways that abortion providers are harassed and personally assaulted for the work that they do, not the patients, but the people who provide the abortions. And so this one is more about the problems that patients face trying to get an abortion.
And so it's published, and it's where now?
It was published in early February from California Press, and you can get it wherever you get most books.
So tell us about the book. Tell us some of the things you found.
Sure. So the book walks through sort of every step along the way, from a moment someone finds out they're pregnant to the point when they get an abortion, and says, how are the ways that the law and society try and interfere with this? So we really go step by step and look at all the things that, a lot of patients, like you described, they get an abortion, they might not know about all the laws that are in place that affect their ability to get an abortion, and they just do whatever their medical care provider says. But there are so many hurdles that people have to overcome, especially in the more conservative states in this country, to get what is really a common, safe medical procedure that almost 1 million people get every year. And yet there are so many hurdles that people have to overcome. So with this book, we wanted to show all those hurdles, what we call obstacles, all those obstacles that, but what we did find, patients are really resilient. They are, for the most part, able to overcome these obstacles at great cost to themselves, to their families, but they overcome these obstacles. And the abortion providers who provide care are able to work around these obstacles and still provide safe, high quality medical care to the patients in the face of legislators who want to stop them from doing so. Basically, they want to end abortion, so they're putting all these obstacles in the path of people to make it harder. And yet the providers are so resilient, so innovative, they are still able to provide high quality care, even in this really terrible environment.
It never seems to me to be about the medical care. It always seems to be about something else when it comes to abortion. It's never, and the conversation is not the quality of care.
Right.
Unfortunately, yeah, go ahead.
One of the chapters we have towards the end of the book is how legislators regulate the procedure itself and tell doctors and nurses how to do the procedure and who can do the procedure. And what's notable is exactly what you said, which is that it's not based in medicine, it's not based in science. If it were, then nurses and physician's assistants would be able to provide abortion up to 10 or 12 weeks all over the country because it's safe, maybe even safer than doctors providing abortions. But it's not about science, it's not about medicine, it's about politics. And so we have legislators who are not doctors, they're not medical professionals, they don't read medical journals. We have these politicians making laws about medicine with the goal to interfere with people's ability to make their choices about their life and their body.
So I'm going to ask you both the same question, and there's a lot to talk about here. So David, what made you get into this?
So it's a good question. It's probably the fact my father's an OBGYN. So he does not provide abortions, although he works with high-risk pregnancies and works with abortion providers. So that probably has a big part of it. But I think it's also because, to me, this is an issue that is the essence of individual freedom and individual determination about your own destiny, and about equality, that people can't be equal until they are able to control their reproductive future. And to me, it seems like such an essential issue for people to be their own full selves. So and then I started working representing abortion providers. I thought they were amazing people who did great work caring for their patients. And I want to make it so that both patients and providers can meet with each other in the way that is medically sound and responds to the patient's desires and not to a politician's desires.
Yeah, I don't like anybody telling me what I should and should not do about my
Exactly.
body. That's for sure. Carole, and why you?
Well, I'll answer in a second, but I did want to show your viewers a copy of our book. We're very proud of this, although no credit to us. The book design, the jacket design actually won a prize. So we're very proud of that. Anyway, how I got into this, really being in the right place at the right time. I mean, it was a question of biography. I was finishing my PhD in sociology at the University of California in Berkeley in the early 70s. And, you know, the feminist movement was exploding all around. I mean, abortion was one of many issues that, you know, the feminist movement was bringing to the table. My thesis work was not on abortion, it was on childcare. And I know it might sound strange now to your listeners, but childcare in the early 70s was a very contentious issue, not quite at the level of abortion, but along the same lines. In other words, the state is going to tell, but, you know, I mean, those who were opposed to childcare said, you know, the government's going to take charge of your children. Anyway, that got me very interested in the relationship of government and social policy, and especially in the emergence of a new right wing in this country. Then I moved to Philadelphia in 1974 to start my career. As I mentioned to you earlier, Marilyn, I started teaching at a school of social work. Some of my students, when they graduated, got jobs at the local Planned Parenthood in Philly, which was just setting up its abortion service. I had taught them a course called Gender and Social Policy, although in those days we called it Women in Social Policy. And anyway, my students got jobs at Planned Parenthood, and they contacted me and they said, Carole, you'll find this really interesting. Come on down to the clinic. And I did, and it was fascinating. It was fascinating for me, who had not been politically active in this issue. It was fascinating for me to see from what you might say a scholarly point of view, what it means to take an issue that had been a social movement issue, and now you had to make decisions. How are we going to set it up? Do we need counseling? Do we need special counseling? Who do we need to do this work? So I stayed in that clinic for a couple of years. I wrote a book about it. And, you know, when you're a sociology professor, you can study anything you want. Nobody tells you, you know, what you need to study. So I could have moved on to something else. I could have gone back to studying childcare, which remains to me still a very interesting, important issue. But I found this world of reproductive health so fascinating that now, more than 40 years later, I'm still studying it. I mean, it's the quote gift that keeps on giving. You never run out of things to think about and ask questions about.
So to you, what is the most fascinating part about it?
To me personally, what is one of the most fascinating parts is how people can keep doing this work. I mean, I'm not saying that's the only fascinating or even the most important. Arguably, the most important thing is that, as you said before, Marilyn, you know, women need, and as David said, women need to be able to control their bodies if they want to be truly equal in this society. But to me personally, as an investigator, I've been particularly interested in the role of abortion providers, who are unlike any other branch of medicine. like David, I also have a father who was a doctor. He was a cardiologist, so I was already interested in, in medical people. But as I began to study this world and I saw the enormous contrast between my father's a very humanistic doctor, and I think that also gave me an interest in in doctors who are humanists, and not obviously not all are. But when I saw nobody picketed at our house. My father didn't get death threats. I was not persecuted. My siblings and I did not have protesters coming to our schools and screaming at us, or coming to our place of worship and screaming at us. So for me, the most fascinating question that I've studied really since the 70s is, how do people who do this work keep sustaining their commitment to do this work when they face so much opposition? And often, not to put too fine a point on it, we've had now 11 members, not all doctors, some receptionists, some volunteers, one off-duty policeman, but I believe the number is now 11 people affiliated with the abortion issue in one way or another, have now been murdered. Most tragically, a few years ago in Colorado, 2 individuals were killed only because they were sitting in a Planned Parenthood clinic, one accompanying his girlfriend, another woman accompanying her friend. They were not even there for an abortion. They were there at Planned Parenthood, most likely for something else. So the violence is really unspeakable.
I have lots of questions, but there is a question on the chat. So I want to read it to you. And then, and this is for David in particular, I think. Is RICO still an effective tool for you to use in the courts?
So RICO is a complicated federal statute that prohibits sort of conspiracies against internet crime, federal conspiracies involving interstate crime. And so there was a case involving a challenge against protesters and the impact they had on clinics under RICO that went back and forth to the Supreme Court multiple times. And ultimately, the Supreme Court ruled that RICO could not be used against protesters in their protest activity that has a detrimental effect on clinics. It can only be used against protesters if they are engaging in criminal activity that ultimately shuts down clinics, even if they have conspired to target a clinic in non-criminal ways with the ultimate goal of shutting down the clinic. That is not enough under RICO. They need to involve some kind of bribery or extortion or crime of violence and a conspiracy across interstate lines. And so the murders that Carole was talking about just before, there have been some attempts to try and look into whether there was an interstate conspiracy to involve those to engage in those murders. But as much as there is some evidence that some of the murderers were engaged with other members of the anti-abortion movement, that's never been proved in court. And they are treated as lone wolves who, yes, they were influenced by the anti-abortion movement, but they were not part of some massive conspiracy to murder doctors, patients, or assistants. So RICO is still an option, but the hurdle is pretty high legally to use RICO to go after these anti-abortion extremists.
So talking about both sides, can you give me some good arguments, on both sides of the coin that, in other words, for and against? What's a good against abortion argument that you know of that makes sense? Is there any? Wow. Quiet.
Yeah, so I mean, I have a good argument for why an individual shouldn't get an abortion if they don't want to.
Right.
Um,
Yeah.
but to tell someone else not to, I mean, so right. So to me, if you fundamentally believe that a fetus is a life, is a baby, I'm not going to convince you otherwise. And I don't think there's any argument on the other side. Very few arguments on the other side. If you firmly believe that abortion is murder, I don't. I don't think 70% of American public don't, because they support legal abortion in some form. But if that's your belief and you sincerely believe that, I certainly respect that belief, and I'm not going to be able to change that with any argument. But that's a belief system, and it's hard for me to say, is that a good argument or a bad argument? I disagree with that argument, but it really comes down to fundamental beliefs.
I think what makes these arguments complicated is that it's been shown again and again and again that when we speak about politicians, those who are against abortion are disproportionately the politicians who will vote against any kind of social provision, any kind of childhood health, welfare, all these things that would make a poor woman able to continue the pregnancy. And this seems a good time in our conversation, Marilyn, to make the point that, as we do throughout the book, that it is disproportionately poor women who get abortions, disproportionately women of color. 50% of abortion patients live below the poverty line. Another 25% live just a bit above it. So we're talking 75% of those who get abortions are poor. And those who oppose abortion do, as a whole, do very, very little, if next to nothing, to help them keep the baby, keep the pregnancies. Now, there is one exception. There's a tendency within the Catholic Church. It's called seamless web. And this group are both against abortion, but very much for government provisions to the poor. But this is a very small segment of the anti-abortion movement.
I'm very involved in some of the helping to eliminate, the addiction, opioid addiction, stigmas, and all that kind of stuff. So you mentioned stigmas. I mean, I'm not going to take an opioid. And if I did, I'm not going to get addicted. But people do. That doesn't mean that I, have to think badly and down upon somebody who does get addicted, because I understand what the story is. I understand it's a disease. I understand that, they're not bad people, right? So it's the same kind of thing when we're talking about abortion and the stigma. I think it's very important to focus on that stigma. And when I read in your book some of the cases that you cited, and I'm like, it even makes you more anxious, I guess, when you hear the specific stories. Because how often do you actually get to hear the specific stories? You hear a blanketed statement of, it shouldn't be this way or it should be that way. But when you actually hear a young woman talk about, what it took her to get an abortion, I mean, are we kidding? I mean, why would it have to be like that? It's her body. Whether she has a disease, whether she was raped, whatever the reason, she decides she doesn't want to carry a child to term. It should be her choice. And if she chooses to have it, then maybe there should be some help. Right.
There should be help, and we should get rid of the obstacles that are in the way. Right.
Yeah.
And I think you're right. When you hear these stories, it's really heartbreaking, especially when you hear the stories of patients trying to get abortions in some of the states where we don't have those obstacles. And so one of the things we really wanted to do in this book is talk about both of those and show how in many states around the country, the situation is bad and it's really difficult. But there are places in the country where if you want an abortion, you can get one just like any other medical care. You need to, get good care, but there's nothing extra put on you because you're having an abortion. And in those states, the stories are, what they should be: the seamless care between providers, providing care based on the standards of medicine, not on what a politician wants. Being able to be seen at a medical office based on their availability, not because the legislature says you have to wait 72 hours. That's what it should be. And we have those stories too. So when you have these good stories about what it could be like, versus the stories of what it is in so many other places, I think it's even harder. We talked to some doctors in some of these states where things are good, and you hear stories like a doctor who has a patient. She's a gynecologist, and the patient comes into her office, and they discover at that office appointment that she's pregnant. And this patient, she's say 6-8 weeks pregnant, and the patient clearly doesn't want to have a child for whatever reason. It's 100% certain. In some of these states, she can have the abortion that day. The doctor gives her pills. She goes home. She takes some of the pills at the office. She goes home and takes the rest of the pills, and she has the abortion. It's seamless. But in other states, she gets that diagnosis on that day. She knows she doesn't want to have an abortion. Now she has to go to a clinic. She has to get care. She has to wait 24, 48, 72 hours. She has to get care only from a doctor, not from a nurse practitioner. She has to be counseled in ways that try to dissuade her from getting the abortion, right? It can be seamless, and we know that because of some places in this country, but it can be so burdensome because of what we know from other places. And that, I think, to me, makes it even harder to tell those stories.
Right.
If I may, I just want
Yes.
to amplify what David was saying, the contrast between states. And you'll forgive my California patriotism or nationalism, but I mean, California is an example of a state that is so different from many of the other states. In California, it does for abortions up to through the first trimester, nurse practitioners and midwives and physician assistants can provide abortions. And this is incredibly important in rural areas where sometimes there's just not enough doctors to go around. In California, abortion providers are allowed to utilize telemedicine, which is hugely important during COVID in particular. And we can talk more about that if you want. In California, Medicaid pays for abortion. Medicaid pays for abortions for poor women. And Medicaid.
Can I ask you a question? What does that do for your state? What does that mean for the health of your state or the quality of your state that this is happening? What isn't happening because this is happening, or what is happening because this is happening?
No, that's an excellent question. And I wish we had good data to answer your question. And I don't want to the point of our book is not that if poor women get their abortions paid for, there's not going to be poverty. I mean, that's not our message at all. And there is still plenty of poverty in California. I wish I had concrete data to give you, Marilyn, but in general, thinking now about some of the research I've seen, in general, California is a healthier state than many other states. I think Alabama and Mississippi routinely come out either first or second as, some of the worst maternal mortality, some of the worst infant mortality. Texas is very high up there also. In all three of the states I've mentioned, abortion is extremely, extremely difficult to get. Mississippi, 1 clinic, Alabama, 3 clinics, constantly under siege by the authorities. And if I can just quickly finish my California, patriotism here, and I think this statistic really is important. 3% of California women live in counties where there's no abortion clinic versus 89% of women nationally. And that, that tells you something. The final California thing that I'll mention, which hopefully will be copied in other states, our governor recently signed a bill saying that all four-year colleges and universities had to have available in the campus infirmaries provisions for, quote, medication abortion. That's abortion, as David recently said, where abortion takes place via pills. And it's very easy for college infirmaries, once they have the proper training, to be able to give this to college students. So that will make access even easier.
So Amnon had a question, so I want to ask. He wants to know if abortions are difficult in North Carolina to obtain. Do you know?
What I know is that there's a fair number of clinics. As I mentioned before, there are a bunch of restrictions that were put in earlier in like around 2010, 11. Your governor now is pro-choice. My understanding, and I'll see if David knows more, my understanding is that the pro-choice movement in North Carolina is trying to get some of the various restrictions, like waiting periods, like I can't remember, and David might, if you have a parental notification or
Yes.
parental consent law,
Yep.
trying to get these things overthrown. So David, let me turn it to you.
So, yeah, I mean, Carole outlined North Carolina has a 72-hour waiting period. So if a patient goes to a clinic, is seen at the clinic, and the clinic can do the procedure that day based on their schedule, she has to wait another 72 hours. And in practice, that winds up being a week to 2 weeks because of people's schedules. The parent of a minor has to consent before an abortion is provided. There is no public funding of abortion through Medicaid in North Carolina, and telemedicine is prohibited. But there are two good things that I can point to. One, there are some really great abortion providers, both Planned Parenthood and independent abortion clinics, not just in Charlotte, but in other parts of the state as well. So that's one. Two, just last week, I believe, a lawsuit was filed in North Carolina State Court challenging most of these restrictions. A bunch of organizations and clinics came together and challenged them, saying that these restrictions violate the North Carolina state constitutions. This is not brought in federal court. This is brought in your state courts, saying that this violates North Carolina state constitutional law. And it will ultimately wind up before the North Carolina Supreme Court, which is controlled by Democrats. Last I checked, it was a 6-1 Democratic majority. I do not know if those Democrats are pro-choice or not, but this is an opportunity, given the makeup of the North Carolina Supreme Court, to possibly have the court system in North Carolina strike down some of these restrictions as unconstitutional. So that lawsuit was just filed last week. It's going to take years to resolve, but that is some reason for optimism when you look forward in North Carolina.
And I'll add the obvious that you have a Democratic governor now, and who one assumes will not keep signing bad things, even if the legislature passes them. So if any of your listeners have any doubt that elections have consequences, having a Democratic governor is huge in terms of reproductive freedom for people in this state.
I'm not hearing you,
I'm
Matt.
not I got it.
Okay.
I'm not like all into the constitutional law. So tell me what makes this unconstitutional. What is in the Constitution that makes this unconstitutional?
So the federal Constitution, I'm not familiar with the North Carolina Constitution. The federal Constitution prohibits invasions of your liberty by the government, by both the federal and the state government. And it's a broad term. Liberty is a broad term. But the Supreme Court has said that when the government interferes with basic family and bodily decision-making, that is an infringement on your liberty. And it has said this with regard to contraception, with regard to sterilization, with regard to what types of schools you can send your kids to, with regard to medical care decision-making. So these are all things that are really personal decisions having to do with our own individual and family autonomy. And so in that sort of general sphere of things, the court has said the right to choose to have an abortion is part of that, because that's about choosing when and how and if you want to have a child. And so that goes to bodily autonomy and familial autonomy. You have the right to marry too, that's part of it as well. So it's sort of this class of rights that we have under this idea of liberty that have to do with personal autonomy. That's where the court has given us this constitutional right to abortion. And so that's why we have Roe v. Wade and the cases that have come from it.
Interesting. Hold it. We want to hold up your book again? Let's give you another plug. Yeah. Oh, you both have it.
We
Okay,
both
good.
have it.
Okay. And well, so from doing, one of the things that I got when I was reading through your book was about the young woman who went to a clinic, and then right next door was the exact building that looked just like the clinic she was supposed to go to. That is horrifying to me. So I want to explain to people who haven't read the book, but you got to read this because this is really amazing. Go ahead, David.
So there are thousands and thousands of what we call fake clinics, sometimes less pejoratively called crisis pregnancy centers across the country, many more than abortion clinics, outnumbering them by a lot. These fake clinics are usually run by religious organizations that oppose abortion, and they pose as abortion clinics. So in many places, they are right next door or across the street from the real abortion clinic. They will have the name, instead of saying North Carolina Women's Center, and that's the abortion clinic, it'll say North Carolina Center for Women, and that will be the fake clinic. They will use the same font. They will have a website that looks like a medical website and makes people think that they've landed at the abortion clinic's website. They will have people who wear scrubs or a white lab coat when you enter the clinic. And they will have brochures that look like medical brochures. But once a patient gets into the clinic, the fake clinic, often not knowing that they are in a fake clinic, they will be lied to, counseled against having an abortion, and being given an ultrasound that is misread. So imagine you're 15 weeks pregnant and you have an ultrasound at a fake clinic and they tell you you're 10 weeks along and you have plenty of time to make a decision. And you think you have 5 weeks longer than you do. Or the reverse. You're 18 weeks pregnant and the limit in your state is 20, and they do an ultrasound and they say, oh, you're 24 weeks pregnant. You can't have an abortion, when you actually had a few more weeks to have an abortion. So there are lies that really impact the ability of people to get an abortion. And most people who go to fake clinics wanting an abortion ultimately wind up at the real abortion clinic because they find out. But the emotional distress, the invasion of privacy, and the deception is really serious here, and it happens all over the country. And in most places, they are unregulated, and they are actually supported by state dollars in a lot of places. My state, Pennsylvania, where I live, $7 million a year gets sent to these fake clinics as part of a bargain in the state legislature to provide family planning dollars to the Planned Parenthoods and the other clinics. Part of the bargain was to also send equivalent amount of money to these fake clinics. So they are state-supported, and the state-supported organizations that lie.
Wow.
Yeah, there's a really wonderful documentary that I would encourage people to look at that I think it's through HBO. It's called 12th in Delaware. the number 12, 12th in Delaware. It's an address in Florida. I forget the town in Florida. But on one side of the street is a real abortion clinic. On the other side is a fake clinic. And these documentary producers had really excellent access to both. And it really shows what happens at these fake clinics. Even though they had the people who run the clinic, the fake clinic gave access to the documentary producers, it did not wind up looking flattering the way they talk about the people who come there. But I would strongly recommend it to anyone interested.
That's amazing. I couldn't believe it. I had never heard of anything like that. So it was really shocking. And I just want to say that Chris has written a bunch of stuff on the chat that I cannot completely read. So Chris, if you want to call in and share about North Carolina, you most certainly can. And Amnon is saying that there is a clinic near where he is, and there's a lot of people going there. So
A fake clinic.
No, a real clinic.
Real clinic, yeah.
I'm assuming, Amnon, you're talking a real clinic. So if I'm wrong, tell me, but I'm assuming it's a real clinic.
It's definitely a real clinic.
Yeah, I mean, the real abortion clinics, they get, they get a good number of patients. There are a lot of, like I said, I think the last census was about 850,000 abortions a year around the country. So that's,
I would even say that they get that many in here in 1 year, because it is unfreaking believable, the traffic that goes in and out. I put in the chat, if some of those restrictions will be removed, they will have to widen their driveway, because it is absolutely ridiculous, the number of people, and it's a huge parking lot, and it's always packed 6 days a week, morning till night.
It goes to show the need for this medical procedure, especially in a country where sex education and basic contraceptive care are not provided as needed for people throughout the country, especially for people who are living in poverty, that the healthcare needs of people and the information needs are not being met right now.
And if I can also add to that, in response to Amnon's point, my assumption is that a lot of the traffic that you see, Amnon, are people who don't live in Raleigh, who come from quite some distance. I mean, abortion clinics are not geographically accessible for many people. Going back to the statistic I gave earlier, 89% of American women, live in a county that doesn't have one. So a lot of what you're seeing are people who have traveled many, many hours from other places.
I'm assuming that clinics are not being built on a regular basis either. I mean, that we're not increasing the amount of clinics, I would assume.
It's very hard to do that because of some of the things we write about in our book, which are called TRAP laws, TRAP. It stands for Targeted Regulation of Abortion Provider. And these are really minute regulations of the facility itself. So hallway width, HVAC system, elevators, where medicine is stored. Now you might say, oh, that sounds reasonable, right? We need to regulate how medical clinics are set up. But these are being regulated, these are being targeted at abortion clinics only. So abortion clinics have a safety record that's better than almost every other outpatient procedure. Most abortions take place in the first trimester and take less than 5 minutes. So when you think of other medical procedures that take place in outpatient facilities that are equally safe, equally quick, those places are not being regulated in the same way. These are regulations of just abortion clinics. And so it's really hard and expensive to build a new clinic in most places around the country because of these laws.
And again, if I can add, one of the main concepts that David and I use throughout our book is something we call, quote, abortion exceptionalism. In other words, that the way abortion is treated like no other aspect of medicine, in terms of the legislative interference, in terms of the rules that are set up, in terms of hospital policies, and so on and so on and so on.
So you also mentioned, and I know this is going fast, so we're not staying in one subject too long because there's a lot to talk about. But our audience can buy your book. Talk to me about COVID. You mentioned COVID, and I know that's got to be something crazy now with abortion. So talk to us about that.
Well, I've actually this summer spent some time on a project with a colleague. We've been talking to abortion providers what COVID has meant, and no surprise, it's abortion has been impacted by COVID the same way all healthcare facilities are, but again with the abortion exceptionalism. In a number of states, in a number of red states, although not North Carolina, um, uh, the governors tried to shut down abortion facilities, saying, quote, they weren't essential medical care and that abortion used up too much PPE, personal protective equipment. So for neither of these things are true. I mean, if you're pregnant, and you know this, Marilyn, if you're pregnant and don't want to be pregnant, it is essential health care. Furthermore, abortion uses very, very little personal protective equipment. In the case of medication abortion, where you're literally handing somebody a pills, you're not using up, all this equipment.
Kind of going in the other direction.
Right. Anyway, so what abortion providers have done, and they've tremendously, again, showed their resilience, adopted as many policies as possible to minimize patient-provider interaction. For example, is in states where it's allowed, using telemedicine as much as possible. One clinic director that I spoke to said to me, our parking lot has become our new waiting room. In other words, having patients wait in their cars. And in fact, Amnon, that's why you might see such a crowded parking lot, because they're obviously trying to minimize as much patient-provider interaction as possible. Now, one thing that could make abortion care even safer during COVID. And remember, as I said before, a lot of people travel long distances to get to a clinic, and travel isn't safe these days. We know that. One thing that could make it safer is if women were allowed to be if clinics were allowed to mail the pill, take the medical history over telemedicine, assure oneself that this person is an acceptable candidate for medication abortion, and then mail her the pills. I mean, patients are being mailed medications all over the place, but at the moment we have a very complicated situation where the main drug used in medication abortion is not allowed to be mailed, and this is now in the courts.
Yeah, so just a quick note on the courts. So a court in Maryland said that requirement is unconstitutional during the pandemic. So clinics can currently mail the drugs during the pandemic, but Donald Trump has appealed that to the US Supreme Court and is asking the US Supreme Court to jump in and reverse that. And any day we could get an announcement from the Supreme Court, even though they're not in session right now, that as an emergency matter, they are going to involve themselves in this case. So this could be making headlines very soon, any day now, from the Supreme Court, because the Trump administration has appealed that case.
But just to wrap up, Marilyn, with your COVID question, your listeners should know that abortion clinics are open, seeing patients, and doing the best they can to keep both the patients and their staff as safe as possible.
Well, we can keep going on, and we'll have to have you come back. But I would imagine, situation alone with COVID is causing more people to become pregnant, and that we're going to need more. I mean, it's not going to be a pretty thing. Anyway, hold on one second. Amnon, you have my stuff? There we go. My 4 books now are published. In just one afternoon, listening to the hearts of men, listening into the hearts of twins, listening to hearts of millennials. And now I am so delighted to say that in just one afternoon, listening into the hearts of people impacted by opioid addiction is on the Amazon shelf. And I will be working on my next one, which is in just one afternoon, listening to the Hearts of Black Fathers shortly. But okay, you can take that down now. Thank you. Here it is, real life. Just got it. Thank you. Thank you. I'm really excited. It's got great stories from family members, from individuals who are struggling with opioid use disorder and in recovery and so forth. But it's out and it's on ebook and it's print, and October 9th, just to remind you all, if you've been listening, I'm facilitating, I'm one of the facilitators, chairing the committee of an opioid summit. It's called the People's Opioid Summit, and you can go to peoplesopioidsummit.com and find out all kinds of information. We have CEUs available from the North Carolina Addiction Board, which is very exciting because it's not easy to get. We have an amazing slate of speakers coming from psychiatrists, state government, a woman who I absolutely adore, who's going to be on our show in a couple of weeks, and she is a former sex worker. Just panels, teenagers, we're full, and it's going to be amazing, and it's only $20 to come. So go to peoplesopioidsummit.com and get your ticket. You won't regret it, I'm sure. So in our final words, because we don't have that much time left, what would you like, I mean, everybody to know? Is it about the direction? Is it what you ultimately want to accomplish? What is the one thing you want to leave our audience with now? And Carole, go ahead.
What I want to leave your audience with is, if you care about this issue, the extraordinary importance of voting. In North Carolina, you have an opportunity to flip a Senate seat. You have an opportunity to vote for Joe Biden, who in fact will protect and expand abortion rights. Anyway, that's what I want people to know at this time. I mean, the future of abortion really is incredibly tied to the outcome of this election.
Yeah, and so I'll just echo Carole, and it's not just voting for president or even senator, it's voting every position on the ballot, because much of the abortion policy that we've talked about for the past hour is made at the local level and the state level. So, if you're voting once every 4 years, you're not doing it right. You need to be voting every time there's an election that you can possibly vote in, primary and general, because those are the people, not the president, who are making abortion policy. The president appoints Supreme Court justices, and that's hugely important, especially with Ruth Bader Ginsburg being 87. We cannot afford, if you care about abortion, to have more conservatives added to the Supreme Court. But in terms of making abortion policy, it's at the local and state level. So if you care about this issue, you need to look at your local and state elections and see what the issues are there in terms of abortion access and rights, and vote for people who support them in those elections.
And I just want to leave everybody with this. I care a lot about our individual liberties, and I think we all should take a look at that. And because when you start taking away a little bit of this and a little bit of that and a lot of this and a lot of it, you're going to be left with nothing. And I feel really strongly that, I don't think, at the end of the day, I mean, you do what you want and I can do what I want, and that's okay. That's all part of freedom. I mean, I love children. I love my grandsons. But it's my right to do what I want, and it's your right to do what you want in whatever we do, as long as we do it in the nicest way possible. So with that, I want to thank my guests so much for being here today. And I wish you all a wonderful, wonderful day. Carole, David, thank you so much for being here and doing the work that you do. And thank you all for being here and showing up. And if you are against abortion and you want to come on here and talk, come on. I'm a fair talker, because I know I can learn from both sides and all sides, but that's how we're going to do it. It's when people come and they speak and they share their truth, and I'm willing to listen and learn and understand something different. So please let me know if you want to talk, but no bad talk, no yelling, no screaming, just nice talk. Okay? Bye, everybody.
You are tuned to the Nissan Communications Network. If you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it in the archives section at nissancommunications.com. Don't forget to subscribe to our YouTube channel, follow us on Twitter, and like us on Facebook. Sponsored by Telestream's Wirecast software, StreamingGear.com, Carolina Apparel, and DeltaForce.net.